Hi, my name's Karina. I'm going to be your nurse for today, and today we're going to be performing a head-to-toe assessment. Is that all right?
Yes.
Okay. So then I would provide privacy. I would perform hand hygiene in front of the patient, and I would clean my stethoscope in front of the patient with an alcohol wipe. And I would begin. So can I have your name and date of birth?
My name is Malu Hernandez, and I was born June 9th, 2010.
Okay, good. And do you know where you are?
My house.
And do you know approximately what time it is?
6:30.
Okay, good. And do you have any allergies?
No.
Okay. So, and on a scale of 0 to 10, sorry, can you rate your pain for me? 0 being no pain and 10 being the worst pain of your life?
0.
Okay. And you are not under any distress, is that correct? Okay. So the patient is alert and oriented ×3, and she is clearly not under any distress and no pain. So then I would begin by assessing the head and the neck. And I'm looking at her hair. She has it in a ponytail, but undo it. I'm not seeing any lesions or abnormalities or unusual patterns of hair. I don't see any infestations, lice, or dandruff. And the hair overall looks healthy. So there's nothing wrong with her scalp. Moving on, I would assess her face and neck. Her face is symmetrical as well as her neck. I'm not seeing any lesions, abnormalities. Her skin color is normal for her ethnicity. And now her skin is warm bilaterally. And as you can see, her speech is well. She is able to understand me and is not having any abnormalities there. Moving on, I would assess her pupillary response, or PERLA. So can I have you look at the light for me? Or look straight ahead, actually. Okay, so her pupils are equal, round, and reactive to light. And now I'm gonna have you look at my pen light, and then look at the wall. And then look at my pen light again, and then look at the wall. Okay, so her accommodation is normal. When she looks away, her pupils dilate, and then when she looks at my pen light, they constrict. So her accommodation is normal, and her PERLA is normal as well. And then I'm gonna ask you to open your mouth. Okay, so her oral mucosa is normal and pink and moist. I don't see any cuts, bruises, lesions, or swelling of any kind. Can you say ah? Ah. And her uvula rises when she says ah. So that's good. And then I'm gonna have you stick your tongue out, puff your cheeks, squeeze your eyes shut, and smile. Good. So all of her cranial nerves are intact. And do you have any difficulty swallowing?
No.
Do you have a cough right now?
No.
Okay, so she does not have a cough. She does not have any difficulties swallowing. All of her cranial nerves are intact, and her overall face and neck are normal. So moving on to her spine, I'm gonna have you turn around. I'm going to check her cervical range of motion. Can you turn a little bit more that way? Okay. Over here. So I'm palpating her spine. Do you have any tenderness? No? Okay, and I would assess her spine. You can't really see. And there's no abnormalities present. Her spine is symmetrical. And I'm not seeing any pulsations or lesions. And now I would also check her sacrum and note that the skin is blanchable, but for the sake of the video we're not supposed to. And then so now I'm going to have you turn around And I'm going to assess her skin turgor. And I'm going to check right under her clavicle. Okay. So when I pinch the skin and release it, it goes back to normal. So her skin turgor is firm. And then moving on, I would begin inspecting her respirations. So you're gonna have to breathe normally. Not sure if it's for a full minute. Her respirations are normal. I'm not seeing any difficulty breathing or any issues with her gas exchange. And then I would begin by auscultating her lung fields. I'm going to begin with her back. So I'm going to have you turn around one more time. Okay, I'm going to put this way. And I would check 8 positions on her posterior. Every time you feel my stethoscope move, can you take a deep breath in and out for me? Okay. So. Okay, so her lung fields are equal and clear. I'm not hearing any wheezing or any signs of bronchitis or anything of that sort. And now I'm going to have her turn around. And I would assess the front. Breathe in. Breathe out. Normal breaths. Can you raise your breast for me? Okay, so her lung fields on her anterior side are both equal and normal as well. They're clear. I didn't hear any wheezing or crackling or anything of that sort, which is good. Moving on, I already asked her if she's had a cough or if it's productive, and she said no, so that's good. Moving on, I'm going to check her cardiovascular system. I'm going to begin by auscultating the front. Oh, shoot. Okay. I'm going to check her aortic valve. Breathe in and out. Or don't breathe, never mind. So I'm checking her aortic. Then I'm going to check her pulmonic, which is the second intercostal space. Then I'm going to check her tricuspid, which is right to the left of the sternum. And then I'm going to go to your mitral valve. Or can you raise your breast for me one more time? This is also the apex of the heart. And it is the 5th intercostal space left to the sternum, mid-clavicular. And now I'm going to take your apical pulse for a full minute. And I heard it really well right here. Whenever you're ready. Okay. Your apical pulse was 79 and regular. And then I would move on to your upper extremities. So can you put your arms out? I'm testing her temperature. She is warm bilaterally. Checking the phone. She is warm. And then can you grip your fingers? Grip my fingers. Okay, so her strength is good. I would rate it a 5 out of 5. And then bilaterally, and then I would check your radial pulse. Your radial pulses are equal bilaterally. And again, she didn't have any difficulty with her arm strength. And now I'm going to assess her cap refill and her fingernails. Okay, her cap refill is good. They were both under 3 seconds. And her fingernails are normal. I'm not seeing any abnormalities. And no signs of clubbing or anything like that. And moving on, I'm going to check your abdomen. So I'm going to have you lie down. And show your stomach just a little bit. Can you lay down flat a little bit more? Okay, so now I'm just going to ask you a few questions about your bowel movements and your urination or voiding. So do you know when your last bowel movement was?
No.
The last time you went to the bathroom?
A few hours ago.
And what was it like?
Normal.
Was it formed?
Yes.
Okay, good. And did you have any pain while using the bathroom?
No.
Okay, good. And did it have an odor?
No.
Okay, and your urination, when was the last time you urinated?
Again, a few hours ago.
A few hours ago, okay. And how much? Was it a lot, a little, or normal amount?
Normal.
Okay, and what color was it?
Clear.
Clear and yellow? Okay, good. And then, I'm gonna see, I'm not seeing any abdominal distension or any pulsations or masses on her abdomen. And I would assess her bowel sounds. Okay, so her bowel sounds are active in all 4 quadrants. And now I'm going to palpate gently in all 4. Does that hurt? Okay, so she is not having any tenderness or pain when I palpate, so that is good. And I didn't feel any masses or any guarding. And now moving on to her lower extremities. It's gonna be a little hard. I'm gonna assess her legs. So you can sit up a little more. Okay, I'm gonna assess her temperature bilaterally. They're warm and she has socks on, so I'm gonna show a leg and take her socks off. They are a little cooler on the feet, which is normal. Let me see if I can put this down. Okay. Her color is normal for her ethnicity, which is good. I'm not seeing any lesions, bruises, abnormalities, anything of that sort, which is good. Can you move your legs freely? Do you have any pain moving your legs?
No.
Okay. And I forgot to ask if she had any difficulty moving her arms. So can you move your arms for me? Both of them? Okay, so she's able to move her arms and legs, which I would rate a 5 out of 5. And then I would check her pedal pulses at the same time. So can you raise your feet for me? Okay, we can't see it, but her pedal pulses are equal bilaterally. And then I would check her, I would rate her pedal pulses +2, and I would have rated her radial pulses +2 as well. And then I would check her capillary refill in her toes bilaterally. So can you raise your feet for me again for the in front of the camera? I would rate her cap refill. They are both under 3 seconds. And her skin, like I said, was warm, dry, intact, no moisture in all of her extremities. I didn't see any signs of bruising, distress, any oozing, any secretions throughout her body. So now I'm going to check my rubric to see if I missed anything. I would have asked her if she had any blood in her stool. Did you have any blood in your poop when you went to the bathroom? No. Do you have any belly pain? No. Okay. I think I got most of the skills that I needed to do. So that is the end of my head to toe assessment.